Dr. Emily Chapman has taken the helm at Children's Minnesota at one of the most tumultuous times for U.S. healthcare in generations. Hear about what brought her to lead Children's and where she hopes to guide one of the country's premier pediatric care providers. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Tim Nelson. In this episode, we're going to meet Dr. Emily Chapman, the new CEO at Children's Minnesota. She's a longtime pediatrician and system leader who says her life has been bending in this direction since she was a child herself. She took the top job at Children's just days after the One Big Beautiful Bill was signed that will remake Medicaid, and just before the tragic Annunciation Church shooting brought young gun violence victims to the hospital door. I asked her how the first few weeks have been going.
The first 6 weeks have been not unexpected, sadly. There's so much that's been going on in healthcare for the last several years. We do so much responding to what's shifting in our environment and the needs of our community and things we need to attend to internally, that I certainly, coming into this role, expected that I would see all kinds of things that I didn't expect. Certainly one of them here in Minnesota and that our hospitals are dealing with was this horrific incident at the Annunciation Church and School. That one was particularly heartbreaking, something that I thought could happen, but certainly was devastating to get that phone call that morning. None of us want our kids and our community to go through something so horrific. I was so proud to be part of an organization that unfortunately understands the need to train for, prepare for that kind of an incident, and that kind of an incident occurring with children, which is a bit unique to our perspective here at Children's Minnesota and our community. And as the only pediatric level 1 trauma center that is an organization that's exclusively built to take care of kids and their families, I think we were really in a unique position. And what I was able to see that day was both the heartbreak and the beauty in humanity that responds to one another in these cases. So to be part of an organization that is built to have not only the surgeon on hand, the nurse on hand, the specialists on hand, but also to have those people who lived their lives taking care of the needs of children, often not the physical needs, the emotional needs, the social needs, and surrounding those kids with what they need to be able to, as best they can, come out the other side of a trauma and an insult like this one. And our job is to mitigate that trauma as much as possible. So whether it's a social worker, a child life specialist, a child psychologist who wraps their arms around this family, that's what we're here to do. So on a day like that, you see what is horrific in humanity, and you see what is just spectacular about humanity and their ability to respond to a perfect stranger's need.
And you've been involved in medical education and workforce development as well, so you, I am sure, have a sense of how this has impacted your staff as well.
Absolutely. People who commit themselves to a life of taking care of children and families when they're in distress, it's something that they carry at their very core. That makes them good at their job. It also makes them vulnerable to having their own personal physical, mental health challenges associated with that lifelong stress. The beauty of pediatrics is there is so much that fills our cup, but then there are days like this where you can't even find a cup for what is being poured on you. And so being attentive to their needs, we understand so much about trauma because we approach every child and family with a trauma-informed lens on the care that we deliver. So when we turn that on our staff, we have to do the same thing. Healthcare workers are absolutely moving through an environment that has routine traumatic incidents associated with it. And that's an important responsibility as a leader of a healthcare system, is to know that that is there, to call it out, and to work to mitigate it.
I want to expand the lens here a little because it's also been a very busy summer in terms of the healthcare industry. The One Big Beautiful Bill obviously has some big consequences for healthcare, particularly pediatric healthcare going forward. Talk to me a little bit about what you saw this summer and what you think it means.
Clearly, the foundation is shifting underneath our feet in our country in terms of how we are investing in healthcare and how we're investing in child health. That's disorienting. I think we probably wouldn't have expected to have the number of different adjustments that are coming at us now. So whether it's how we fund healthcare, how we support the health of our population through things like vaccinations, how we support our families with food security through programs like SNAP, all of those are now up in the air. It's hard to know where each one of those pieces are going to land. It's also very difficult to know what the sum total of those adjustments is going to do to our ability to respond to the needs of our children and families in our community.
Obviously, however, you must be very concerned about the future of Medicaid and what role it will have in pediatric health.
We have all been worried about Medicaid for years. As a country, we have underinvested in the Medicaid program such that we have needed to find other ways to try to shore up and support pediatric health services. You know, lots of people don't understand that Medicaid really, when you think of Medicaid, think of the face of a child. The majority of participants are children. Now, they are much less of the cost than the adult population on Medicaid, but the majority of those faces will be faces of children. So we recognize that as we now move into a time where not only were we working to sort of supplement our coverage of cost of care due to underpayments from Medicaid, now Medicaid itself is vulnerable. It's all yet to play out. I think at the federal level, it may look cleaner to our political leaders than it is. How that translates through states, through Minnesota, how we deal with the shortfall in funding for things that are associated with health is going to be something we're really going to have to come together. We're going to have to hold hands. We're going to have to figure out, what does the total picture look like? One piece of it will sound like it's not a lot, 6 or 8 pieces all being shifted together, and we have a very fragile tower of how we fund healthcare in our state, in our country. And I think many of us are quite frightened that that tower is going to topple down on us, and particularly in certain areas. Specialty services like pediatrics, rural services, and rural health. These are areas we're really focusing a lot of attention on.
I want to back up a little bit and talk a little bit about your journey to this role. Obviously, you're new here, but not new to children. Tell me a little bit about your path, how you got here.
Yeah. Well, first of all, when I first entered medicine, it wasn't as a physician, which I think is unusual. A lot of people make up their mind when they're, 6, 7 years old, I'm going to be a doctor, and that's your path. That wasn't mine. At 6 and 7 years old, I was, running around signing up for every extracurricular activity there was. And I think my parents sort of thought, well, not sure what she's going to grow up to be. That really helped me.
Might be a Broadway star, might be a doctor.
I had lots of plans. Yeah. That really has helped me, I think, because it took me on a journey through all sorts of aspects of life that allowed me to experience and come to fall in love with humanity and the breadth of it. I actually started in a healthcare setting at Children's National, an independent children's hospital, in the area of child life, which I was a child life specialist, which has its grounding in child and developmental psychology, really. And how do you help a child in the context of siblings in a family understand what is happening to them, whether it's an acute illness or a chronic illness? How do you teach them about medical procedures and interventions that are going to impact them? And how do you help them continue on a healthy development track, or how do you help them continue along a developmental track that is appropriate for their age? That then made me fall in love with multidisciplinary teams, everyone focusing with the patient at the center. I began to crave wanting more of an understanding of the science and the biomedical information so that I could weave that into my conversations with family. That led me to medical school. That led me into pediatric practice, and then joining Children's Minnesota, an organization that I had long depended upon both in my own training, but also as I was taking care of children in my pediatric practice in our community. I would routinely come into Children's Minnesota both to see patients of mine who were hospitalized, but also to teach the residents who were coming up. Moved then to employment at Children's Minnesota in medical education. And there is nothing like putting into words what you do every day in the context of teaching to help solidify your own learning, but also to make you be able to appreciate the experience you're having in a lifetime. I moved then into leadership, and I see it very much the same way. I think all of those years as a 6 and 7 year old, joining everything that my parents would let me sign up for, I draw upon all of that as I cross paths with all different families, community partners, philanthropists, all of whom are looking for that human connection. And that's the foundation on which the whole concept of caring for another human is based. And I think it's the foundation on which our business becomes solid and secure as well. It is simply the high-functioning team, that group of individuals who is committed to one another and committed to the mission and committed at their core, as I said. That's what we do here, and it's such an incredible privilege to get to play in that sandbox and see what we can do together.
Now, you've been involved in medical education here as well as at the University of Minnesota, and one of the things that I've seen that continues to strike me is the real difficulty in the workforce right now in pediatrics. Particularly, I look at the Department of Employment and Economic Development, their job vacancies, and it is quite surprising to see what pediatrics look like. How do you address that workforce issue going forward? That's something that you obviously have been living and breathing for a long time.
Mm-hmm. I think lots of people don't understand the difference between pediatric medicine and adult medicine and what that environment is, how as a country we've under-resourced and underfunded the care of a child with the same condition as a 45 or a 65-year-old might have. That's one piece of it. I think healthcare is a very difficult place to be right now. There is a lot of weight on these individuals who dedicate themselves to taking care of other people. But the other thing that's happening is because we have a shortage across both our pediatric and our adult systems, we're working to try and accelerate the training and the pipeline. In doing so, one of the things that we have lost is some of the experience in it, the experiential exposure and learning. In pediatrics, that means that if you go to nursing school, you may never spend time in a pediatric operating room. Or how do you fall in love with running a pediatric operating room and being an assist to a pediatric surgeon if you've never seen it and you can't imagine it? So that, I think, is really hurting us in the workforce, because if you talk to the people who work in this field, you'll find almost always they'll say, that experience that I had, someone took me with them into a space where I saw an exchange that absolutely captured me. And that's what I want to dedicate my life to. We know you aren't compensated for doing care of a small child nearly as well as you are compensated doing the care of a larger adult. Does that make any sense? Absolutely not. But we know that's the situation. So people are drawn to dedicating their lives to this by those moments where they can't turn away from it. And they commit themselves to it. We have to make sure that somehow we are, as hospital systems and as clinics, filling the gap where our training programs are unable to support exposure to what we do, so that we can get that group of people who fall in love with it. I went into medical school absolutely knowing that I was going to work with children when I finished my training. That was the only reason I was there. That was because of exposures that I had. And we need to do that with our pharmacy technicians, with our respiratory therapists, with our nurses, with our physicians, with our advanced practice providers. So we, as a hospital, like many others, are working to not only open our doors, but to actively tell people there is something here to see. And how about if you come on in here and see it? And when we do that, it is amazing to watch people's faces.
So your predecessor obviously had a passion for a particular issue. He wrote a book about gun violence and, used his experience here to offer a perspective on that. Is there an issue that you would like to focus on, that you would like to raise the profile of?
Probably most frightening for me is the loss of confidence in the prevention of infectious diseases for us as a species, let alone, here surrounded in Minnesota. Vaccination is the single most impactful invention that has come out of medicine, along with the ability to treat bacteria, antibiotics. The fact that we're turning away from that now is very, very frightening. I believe that we as pediatricians cannot stand by and allow our population, our parents, to misunderstand the criticality of this. I think one of the things that, understandably, people will take a position that this is a family's personal choice to be protected or not. Yes, and we live in a society. The way vaccination works is you vaccinate the entire herd, if you will. And the fact that some vulnerable child is protected, encircled by individuals who have immunity against one of these deadly viruses, is what protects that child. So this concept of herd immunity. So we are not just talking about, am I worried that I personally will contract polio? What we're talking about is, if I am not part of our entire herd being immune to polio, I am leaving vulnerable those patients who are not old enough to be vaccinated yet, who have immune systems that don't respond appropriately to vaccination, or who have medical conditions such that they can't be vaccinated. And that's on us as a society. So I don't know that this is an individual conversation. This is a society conversation. I think we have to go ahead and have that.
Obviously a big issue to address, but right now you're sitting in the corner office at Children's Minnesota. How would you like it to be different when your successor comes to sit down in this chair?
Wow, there's a question. When a successor comes in, what I hope they find in this organization is an extraordinary group of very talented individuals. We have that today, but a group of individuals that is exceedingly engaged in the issues that matter to the community that we serve. As a not-for-profit organization, we only exist to meet the needs of our community. These last years in healthcare have been so personally difficult for so many who are on the front line. Very understandably, coming out of that trauma, there are those who have taken a step back, who say, I can't do it, or I'm exhausted, I can only bring 60% of me here today. We know that, we respect that, and none of our challenges will be overcome unless we are able to harness 100% of the brilliance, the innovation, the curiosity, the humor, the warmth, the love, the dedication of all of these people. And so I believe that just in terms of timing, if nothing else, that I have an opportunity to help people see the beauty in what they do and to help them reconnect with what they dedicated themselves to, such that we can collectively solve these problems. There is not a damn thing that I'm going to get done on my own. The only reason I walk into a building like this is because it's dependent upon everyone else to do those things. I think my job here is to help them see that in themselves and to help them adore what they do, the hard parts of it, the beautiful parts of it, and that those things are what give them strength and energy rather than taking strength and energy away from them. And if we have that kind of an engaged team, it's not even a workforce, it's a community, oh my gosh, we can solve anything. Without that, we're not going to get far. So that's what we need to focus on.
It's a very worthy endeavor. I think everyone here in Minnesota wishes you the best of luck in that. And thank you so much for your time today.
Thank you. I appreciate it.
Again, that's Dr. Emily Chapman, the new CEO at Children's Minnesota. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.